All right, there's no other way to start out our extraction sequence than by watching a little bit of this here. So, gotta love that gal's face in the bottom left-hand corner there. All right, let's not watch anymore. Anyway, so digging out a tooth. Do a lot of this as a dentist for sure. So, something to get great at getting through the sequence of. So, if a patient comes back and they're planning on having a tooth pulled, there's some people that just need one tooth pulled, but there's some people that need multiple teeth pulled. And so once again, just like with everything else, with a filling, crown, dentures, you always want to just double check with the patient. Hey, so are planning on taking out an upper right tooth or a lower left tooth today? And they say, yep, that's the plan. Or you just want to make sure that the exact tooth that you're going to take out is the exact tooth that they want to have taken out. Because once they're out, they can't be put back in necessarily. So the items that you're going to need, obviously you're going to go through some anesthetic first. I always want to have a patient nice and numb before we do that. So you'll have topical anesthetic. You'll put the topical on, much like with anything else. The more you're trained on it, the more that you'll do. Sometimes the dentist will do that. That'll need to be there for anywhere from 20 to 30 seconds. You'll have a long needle for mandibular, so you'll have that yellow one if you're going to take out a bottom tooth, or you do a blue needle if you're going to take out a top tooth. Or if you're going to take out both, oftentimes just go with the long needle. And if you need a short one, you can always get a short one later. But oftentimes I'll just use a long one, for everything if I'm going to be doing both upper and lower at the same time. Like if I'm going to be doing a set of wisdom teeth or something like that. Obviously, I have the syringe set up. Usually, I'll always do two, carpules per tooth. Unless I'm going to be taking out multiple teeth, then I'll get creative. So, but always have both different types of anesthetic out. If you don't know what type the doc prefers, that way they're ready to go. And then once again, you want to have the saliva ejector ready to go, so that way as soon as you give the injection and as soon as you take out the topical, you can have the patient close down on the saliva ejector, and that way they don't get any of that taste, or minimizes the taste as much as possible in their mouth. So with an extraction, you never know what you're going to kind of come up against. If a tooth is loose, most likely it's going to come out fairly simple, but sometimes I've had a loose tooth that I've had to do surgical before. So you always want to be prepared for any tooth to turn surgical just in case it does, which really the only things that you'll need are a handpiece and a surgical burr set up ready to go just in case the dentist needs it. Very rarely will you need like a scalpel or sutures or anything after that, but all those are contained in the kit and you'll have it available if you need it. You just don't necessarily need to have it set out ready to go. The one thing that you'll do is you'll numb up the patient and then we gain consent. So because it's an irreversible procedure, we want to make sure that they are aware that once we take out the tooth, we're not going to be able to put it back in again. So we just need to make sure that there's like a double check of a patient saying they know what the risks are involved and that they're going to have the tooth taken out. So you go over the consent, you ask the patient if they have any concerns, and then you have them sign and date it there. The dentist will also always ask, do you have any questions about, the procedure that we're going to be doing today? A lot of people that are having a tooth pulled have had a tooth pulled before, and so they've kind of gone through the experience, but a lot of people, if it's their first time, they're going to have a lot of questions. And then before we start the procedure, you want to make sure you ask the dentist what type of forceps that they would like to use. And that way, when you come back and you're ready to go, the forceps already set up and you're off to the races. So the first thing that you're going to do once the patient's numb and you're ready to go and you're ready to start taking out the tooth, the first thing they're going to do is the dentist is going to reflect the tissue from the tooth. Try and loosen the tissue from the tooth, and then you loosen the tooth from the bone. So you'll have what's called mucoperiosteal elevator that the dentist will use. Sometimes they'll use a curette, but they're going to slowly but surely reflect that tissue. Once that tissue is reflected, you're going to make sure that once it starts bleeding, that you try and keep the suction, the surgical suction on there, so that the patient, number one, doesn't have any blood go down their throat. So that's one of the biggest jobs that you have during this procedure, and to make sure the dentist can see what they're doing. So you're always going to be in there, always suctioning all the time. So that's going to be the big thing for extractions. And if the dentist ever says, "Hey, you're in my way," then you're good. And you can get out of their way. But I would err on the side of trying to keep it clear and keep everything, so the dentist can see and make sure the blood's not going back to the patient's throat. So stay in there as much as possible. Typically, a simple extraction, they will use that mucoperiosteal elevator. They use a small, large straight elevator, then a large straight. Then that's when the tooth starts to move around a lot, and then they grab it with the forceps to take it out. So it's not like necessarily that they're using the forceps to take the tooth out. They're using it just to remove from the mouth, if that makes sense. So it's already going to be very loose before they grab it. Typically, if you're going to do a surgical extraction, either if the tooth breaks off at the gum line or you need to go in there and you need to get a root tip, then you're going to be able to use this handpiece to be able to remove all of the bone around there, or removing tissue, sectioning the tooth if it has 3 different roots. But so just like drilling for a crown or a root canal or a filling, you're just going to be in there with the HVAC instead of the surgical suction, making sure that everything's cleared out, ready so the dentist can see, and that the patient's comfortable and they don't have too much water or blood going down their throat. So you'll make sure that everything's good there. If you need to place in sutures while we're doing the surgical extraction, it's always a good idea just to ask the dentist, or to get into his mind if he hasn't told you, you plan on doing sutures when you're done. And that way you can be prepared to get out sutures and be able to cut the sutures when the dentist is done sewing up the gums. So typically small straight, or you do the periosteal elevator, small straight, large straight, grab it with the forceps, take it out, and then you'll have some gauze ready for the doc, or for you. He may have you place the gauze there over the extraction site and have you bite down, so that way that they can start getting some hemostasis, or getting the clot to start forming. So another thing too that you're always going to be want to be aware of is, while you're doing a surgical extraction, most of the time there's prescriptions that are given afterwards, either an antibiotic and or a pain pill in case they need it. So those are something for you to be able to ask the dentist to make sure that you are aware of that, so that way that you can print those off and have them ready to go after the patient is sat up and ready to leave. Some of the post-op instructions that we have are going to be on a piece of paper, and you can walk through those with them. But the biggest thing is just to hold on the gauze for 20 to 30 minutes and don't suck through a straw. Those are kind of the big ones to hit. Other than that, staying on top of your medications is also another very big one. So that's kind of a general outline of how an extraction goes. It's actually not too simple. That's what I love about extractions, is the whole goal is get the tooth out, and once you've kind of gotten in there, if it turns surgical or turns a little bit longer, then you just kind of get creative and hand the dentist whatever they need. Anyway, really exciting.